What drew you to a career in neonatal intensive care nursing?
I have always been drawn to a career in neonatal intensive care nursing because of my deep passion for providing care during one of the most vulnerable and critical stages of life. From the start of my nursing education, I found myself particularly interested in pediatrics, but it was during my clinical rotations in the neonatal unit that I truly discovered my calling. Witnessing the resilience of premature and critically ill newborns, coupled with the profound impact that skilled, compassionate nursing can have on their survival and quality of life, inspired me to pursue this specialty. I am also motivated by the opportunity to support families during what is often a challenging and emotional journey. Being able to provide not only medical care but also emotional reassurance and education to parents is deeply fulfilling. The complexity of neonatal care, which requires advanced clinical knowledge, precision, and a multidisciplinary approach, also aligns with my commitment to continual learning and professional growth. Ultimately, neonatal intensive care nursing allows me to make a meaningful difference in the lives of the smallest and most vulnerable patients, which is incredibly rewarding.
How do you handle the emotional challenges of working with critically ill infants and their families?
Handling the emotional challenges of working with critically ill infants and their families requires a combination of empathy, resilience, and self-care. I approach this aspect of my work by focusing on the positive impact I can make, whether it's providing life-saving care to an infant or offering emotional support to their family. Understanding that I am part of a team helping these families through some of their hardest moments gives my work purpose and helps me remain centered. I also make a conscious effort to build strong communication with families, offering them compassion and clear explanations about their child's condition and care plan. This transparency helps to alleviate their fears and fosters trust, which can be emotionally uplifting for everyone involved. Witnessing their strength often inspires me and reinforces the importance of my role in their journey. To manage the emotional toll on a personal level, I rely on professional strategies such as debriefing with colleagues, who share similar experiences and can provide mutual support. I also prioritize self-care outside of work, including activities that help me recharge emotionally and maintain a healthy work-life balance. Additionally, reflecting on the progress and success stories in my career helps me stay positive and grounded, even in challenging times. Ultimately, I believe that acknowledging and addressing my emotions proactively allows me to remain compassionate and effective in this demanding yet rewarding role.
Describe your experience with neonatal resuscitation and stabilization techniques.
My experience with neonatal resuscitation and stabilization techniques has been a critical part of my professional practice as a neonatal intensive care nurse. I am well trained in neonatal resuscitation through the Neonatal Resuscitation Program, NRP, which I have completed and regularly updated to stay current with best practices. This training has provided me with the knowledge and confidence to respond effectively to emergencies involving newborns requiring immediate intervention. In practice, I have been involved in numerous scenarios where neonatal resuscitation was necessary, such as assisting newborns with compromised breathing or heart function immediately after delivery. I am proficient in performing techniques such as positive pressure ventilation, chest compressions, and advanced airway management, including endotracheal intubation when required. Additionally, I am experienced in the administration of life-saving medications and fluids as part of stabilization protocols. Beyond the technical aspects, I understand the importance of maintaining composure and working collaboratively with the neonatal team to ensure coordinated, efficient care. Clear communication is vital during such high-pressure situations, and I make it a priority to ensure that everyone involved is aligned on the steps being taken. My goal is always to stabilize the infant quickly and effectively, giving them the best possible chance for recovery and ongoing care. These experiences have deepened my clinical expertise and reinforced my commitment to providing the highest standard of neonatal care.
How do you ensure accurate and timely medication administration for fragile infants?
Ensuring accurate and timely medication administration for fragile infants is a responsibility I take very seriously, as it directly impacts their safety and recovery. I follow a meticulous process that prioritizes precision, adherence to protocols, and constant vigilance. First and foremost, I strictly adhere to the 5 rights of medication administration: the right patient, medication, dose, route, and time. This foundation is particularly critical in neonatal care, where even minor deviations can have significant consequences. I double-check all calculations for weight-based dosages, which are standard for neonatal patients, and confirm them against the medical orders and guidelines. If there is any uncertainty, I consult with the prescribing physician or pharmacist to ensure clarity before proceeding. In addition to accuracy, I ensure timeliness by maintaining a well-organized schedule and prioritizing tasks effectively. I frequently use technology, such as electronic health records, EHRs, and infusion pumps, to set reminders and track medication schedules. However, I also remain vigilant and verify information manually, especially in critical cases where a child's condition may necessitate adjustments to the plan. I am also attentive to the specifics of administering medications to neonates, such as choosing the appropriate intravenous site, ensuring correct dilution, and monitoring for immediate reactions. After administration, I carefully document all actions and observe the infant closely for any side effects or changes in condition. By combining precision, attention to detail, and proactive communication with the healthcare team, I ensure that medication administration is both accurate and timely, providing the highest level of safety and care for these vulnerable patients.
What strategies do you use to promote bonding and attachment between parents and their infants in the NICU?
Promoting bonding and attachment between parents and their infants in the NICU is a vital part of my role as a neonatal intensive care nurse. I use a combination of evidence-based strategies and compassionate communication to foster this connection, even in a clinical setting. One of the primary strategies I employ is encouraging and facilitating skin-to-skin contact, also known as kangaroo care, whenever it is medically safe for the infant. This practice not only enhances bonding but also has proven benefits for the baby's physiological stability and the parent's confidence in their caregiving abilities. I guide parents through the process, explaining its importance and supporting them as they engage in this meaningful interaction. I also involve parents in their baby's daily care activities, such as diaper changes, feeding, or gentle touch, even if the infant is in an incubator. These small yet significant actions empower parents, help them feel actively involved in their child's care, and strengthen their emotional connection. Clear and empathetic communication is another cornerstone of my approach. I ensure that parents understand their infant's condition, treatments, and progress, providing them with updates and answering their questions. By doing so, I help alleviate their anxiety and build trust, which is essential for fostering a positive bonding environment. Finally, I encourage parents to talk to, sing to, or read to their baby, even when they cannot hold them. The sound of their voices is comforting for the infant and helps establish a connection. I also help families celebrate milestones, no matter how small, to create positive and memorable moments amidst the challenges. Through these strategies, I strive to create an atmosphere where parents feel supported, connected, and confident in their role, laying the foundation for a strong and loving bond with their baby.
How do you manage complex clinical situations, such as multiple births or infants with severe congenital anomalies?
Managing complex clinical situations, such as multiple births or caring for infants with severe congenital anomalies, requires a combination of advanced clinical expertise, meticulous organization, and effective communication within the healthcare team. My approach prioritizes the infant's safety, the coordination of care, and providing emotional support to the families involved. For multiple births, I start by thoroughly preparing before delivery. This includes reviewing maternal and fetal information, ensuring all necessary equipment and supplies are ready, and collaborating with the multidisciplinary team to assign specific roles for each newborn's care. In the delivery room, I stay focused and organized, ensuring that each infant receives individualized attention, whether for immediate resuscitation, stabilization, or initial assessments. Post-delivery, I monitor each infant closely, maintaining detailed records to track their unique needs and progress. I also work to keep parents informed about each baby's condition and treatment plan, providing reassurance and clarity during what can be an overwhelming time. For infants with severe congenital anomalies, I take a holistic approach that combines technical proficiency with compassionate care. I collaborate closely with neonatologists, surgeons, and other specialists to create a comprehensive care plan tailored to the infant's specific needs. This often involves managing advanced life support measures, monitoring for complications, and implementing family-centered care practices. I ensure that I am well versed in the infant's condition and any necessary interventions, staying adaptable to changes in their clinical status. Throughout these complex situations, communication is key. I maintain open lines of dialogue with the healthcare team to ensure seamless coordination and quickly escalate concerns when necessary. Equally important is the emotional support I provide to families, acknowledging their fears and helping them navigate difficult decisions. By balancing technical skills, teamwork, and empathy, I can manage these challenging cases effectively while prioritizing the best outcomes for the infants and their families.
What is your experience with family-centered care and involving parents in decision-making?
Family-centered care is at the core of my nursing practice, especially in the NICU, where parents play a vital role in their infants' care. My experience with this approach has taught me that involving families in decision-making not only supports their emotional well-being but also enhances the overall quality of care for the infant. I prioritize clear and empathetic communication when involving parents in their child's care. This begins with actively listening to their concerns, answering their questions, and providing thorough explanations of their infant's condition, treatment options, and progress. I make it a point to use language that is easy to understand, avoiding medical jargon while ensuring they feel informed and empowered. In my practice, I encourage parents to participate in daily care activities, such as feeding, diaper changes, or soothing their baby, as appropriate for the infant's condition. These interactions help parents build confidence and foster a deeper connection with their child. Additionally, I provide education tailored to their needs, such as demonstrating how to handle medical equipment if their baby requires it or preparing them for life after discharge. When it comes to decision-making, I work closely with the healthcare team to present parents with all the necessary information and options, ensuring they feel supported in making choices for their baby. For example, in cases involving complex medical decisions, I strive to create an open, collaborative environment where parents feel heard and valued. I also acknowledge and respect their cultural, spiritual, and personal beliefs, which are often integral to the decisions they make. By building trust and fostering collaboration, I aim to make parents feel like partners in their infant's care. This approach not only improves their experience but also contributes to better outcomes for their baby, creating a foundation for ongoing family involvement in the child's health and development.
How do you stay updated on the latest advancements in neonatal care?
Staying updated on the latest advancements in neonatal care is essential to providing the highest standard of care for my patients. I take a proactive and multifaceted approach to continuously enhance my knowledge and skills in this rapidly evolving field. I regularly participate in professional development opportunities, such as attending workshops, conferences, and seminars focused on neonatal care. These events allow me to learn directly from experts in the field and to stay informed about emerging research, technologies, and best practices. For instance, I've attended sessions on innovations in respiratory support for preterm infants and advancements in neuroprotective strategies, which I've been able to incorporate into my practice. I also stay engaged with professional organizations such as the National Association of Neonatal Nurses, NANN, and similar groups. These organizations provide access to valuable resources, including journals, webinars, and online courses. By subscribing to peer-reviewed publications, I stay informed about the latest evidence-based practices and clinical guidelines. Additionally, I actively participate in unit-based continuing education programs and case reviews at my workplace. These discussions provide practical insights into applying advancements in neonatal care to real-world scenarios and foster collaboration with colleagues. Finally, I make time for self-directed learning by exploring reputable online medical resources and databases. This allows me to stay informed about new medications, technologies, and treatment protocols. I often use these insights to contribute to team discussions and enhance care delivery within my unit. By combining formal education, professional engagement, and self-initiated learning, I ensure that I remain current with advancements in neonatal care, enabling me to deliver the most effective and innovative care to my patients.
Describe a challenging situation you faced in the NICU and how you handled it.
One particularly challenging situation I faced in the NICU involved caring for an extremely premature infant born at 24 weeks gestation with severe respiratory distress syndrome and complications from a grade 3 intraventricular hemorrhage. The infant's condition was rapidly deteriorating despite intensive interventions, and the parents were understandably overwhelmed and struggling to cope with the gravity of the situation. To address the challenge, I first focused on stabilizing the infant. I worked closely with the neonatologist and respiratory therapist to adjust ventilator settings and administer surfactant therapy while continuously monitoring the baby's vital signs. I also prepared for emergency interventions, such as placing a central line for medication and fluid administration. During this time, maintaining precise documentation and staying calm under pressure were essential to ensuring seamless communication and care coordination. Equally important was supporting the family through this difficult time. I made it a priority to keep the parents informed, explaining every step of the medical interventions in clear, compassionate terms. I listened to their concerns and validated their emotions, helping them process the situation while empowering them to feel involved in their baby's care. To foster trust, I introduced them to the multidisciplinary team and encouraged them to ask questions, creating a collaborative environment. Unfortunately, despite our best efforts, the infant's prognosis remained poor, and the parents faced difficult decisions about continuing life support. I facilitated discussions between the parents and the care team, ensuring their values and wishes were central to the decision-making process. My role also included providing emotional support and connecting them with counseling resources to help them navigate their grief. This experience was deeply challenging but underscored the importance of clinical expertise, teamwork, and empathetic communication in delivering comprehensive care in the NICU. It also reaffirmed my commitment to supporting both the medical and emotional needs of my patients and their families.
What are your long-term career goals within neonatal nursing?
My long-term career goals within Neonatal Nursing center on continuing to provide exceptional care to critically ill newborns while advancing my expertise and contributing to the broader field of neonatal care. I am passionate about making a meaningful impact not only at the bedside but also in areas such as leadership, education, and research. One of my primary goals is to pursue advanced certifications and education in neonatal nursing, such as becoming a neonatal nurse practitioner, NNP. This would enable me to take on a more autonomous role in diagnosing and managing complex neonatal conditions while continuing to collaborate closely with multidisciplinary teams. I also aspire to mentor and support other nurses by sharing my knowledge and fostering a culture of learning and excellence within my unit. Another goal is to contribute to improving neonatal care practices through research and quality improvement initiatives. I am particularly interested in areas such as neurodevelopmental outcomes for preterm infants and family-centered care models. By engaging in evidence-based research and implementing innovative strategies in clinical settings, I hope to play a role in advancing the standard of care for neonates. Additionally, I aim to advocate for policies and programs that support neonatal health on a broader scale, such as initiatives to improve access to neonatal care in underserved areas or public health campaigns focused on maternal and neonatal well-being. Ultimately, my long-term career vision is to grow as a leader in neonatal nursing while maintaining the deep compassion and dedication that drew me to this field. Whether through direct patient care, education, or systemic contributions, I am committed to making a lasting difference in the lives of newborns and their families.